Hi everyone, Dr. Michelle with Design to Heal, and I'm here today to talk about treating consecutive days. This has been a topic that actually has come up in my practice with some of my patients lately, and so I thought it'd be a great part two to my effective treatment planning video, which is a video that I recommend to all my new patient acupuncture patients, and I'll usually send that off to them to watch before their appointment. So please view that in my Oriental Medicine playlist. And you'll probably have to scroll down pretty far because it was a video that I made when I first started my channel talking about effective treatment planning. It was geared primarily around acupuncture and how each treatment builds on the other like building blocks to get the best results. So please go to that and watch that. And this is secondary part two to that. So I want to share that actually an experience that a patient had, and that really we can recommend doing consecutive days, treating every day, which I know in America, really going for Western medicine every day is kind of an out of the mind concept. However, in Oriental medicine and with other modalities, it can be very beneficial in the beginning stages when you're treating an acute or chronic condition to come in daily and get that repairing and stabilizing building blocks going to get more beneficial, quicker, faster response to getting the results that we want to get. So I do treat a lot of pain, and the story I'm going to share is about a patient who had back pain. But we can really help to reduce the symptoms when a patient comes in consecutive days, meaning every day. It could be 2 days in a row, it could be 3 days in a row, whatever you want to create that doesn't stress you out. Because I always say you want to create what's going to be comfortable for you and what makes you feel good about coming in. So this was a patient that actually had low back pain, and I had seen him a few times before, spaced out over the weeks. He wasn't doing consecutive treatment, but I think he was coming a couple times a week, but it was spaced out probably at least 2 or 3 days in between. And so we treated him that way in the beginning, and then it just happened that for both of our schedules, it worked better if he came consecutive days. So I had him come 2 days in a row for his low back pain, and this was for acupuncture. And when he came back the following week after having his consecutive treatment days, the 2 days, he had no back pain at all, completely went away. And he was amazed. He couldn't believe it. And he's like, I don't have any pain. I don't really need acupuncture. And I said, well, let's just do a little, to keep it going, maintain it. But he was pretty much just ready to jump into the massage and was feeling amazing. So it reminded me how I know in the Orient, I used to hear stories about patients would go in every day with a condition and get treated until the condition was resolved. It might be 3-4 days, it might be a week, which is really, like I said, unheard of out here in the United States. Typically, I mean, physical therapy, you usually go in maybe 2-3 times a week. Acupuncture, that's recommended as well. Chiropractic can also be occupational therapy, but to come in every day consecutive is kind of an out of the box concept. So when he shared that with me, he reminded me how I am often suggesting this to my patients to get faster, quicker responses, and even compare and see how it is doing it spaced out. Maybe, like he did originally the first few weeks, and then coming in consecutive days and seeing if there's a shift with the results that we get. So that was something that I wanted to share and put out there because getting the right treatment plan for each patient is so unique and so important in getting the results that we want to get. Now, this type of therapy, 2 consecutive days, that is something that we do automatically with herbal medicine. The patients are taking their herbs every day, usually more in the beginning, and then they taper off to maintenance as we get them well. Same with ear seeds, and I am going to be doing a video on ear seeds. It's been a while, so stay tuned for that. But ear seeds are usually on for at least 3 to 5 days, and then we remove those, or you remove them, and then we do a new set or a new protocol. Not a new protocol. It might be a new protocol. We've treated the other one, but we'll freshen out and change to a new set of ear seeds, usually within 5 to 7 days. You don't want them on longer than that. So we are treating consecutive days, and then really any other modalities you could consider, getting 2 massages 2 days in a row. Who wouldn't love that? And, I do cupping and all sorts of things, medical spa treatments, you name it. So like people can come in and get the Aculight therapy every day, which is going to help anti-aging. It's going to help the brain with memory and dementia, wound healing, scarring. And then we could also think of the infrared heat sauna with chromolight therapy. That's something that I do every day along with my Aculight therapy. Not as much as I'd like, but it's something that we could safely do every day. The Aculight therapy and the infrared heat sauna. It's so beneficial for all of our systems of the body. So something to consider when you're thinking of what treatments you want and then how to plan out your treatments in your calendar for the most effective treatment. And you might be something you want to play with, compare week to week, and see what works best for you. So I hope that this video was helpful. Planning our, medical treatments is so important. Sometimes people get 1 treatment or 2 treatments and they'll leave, and it might not be the right practitioner that they've chosen or the right treatment plan, and they'll leave thinking, oh, that treatment or that service doesn't work for me. And that's usually not always the case. It's, finding the right doctor, the right fit, getting the right treatment plan, finding the right modalities. And really, that's why I named my business Designed to Heal, because we're creating a health plan designed especially for you, for the patient. We're all different. We all like different treatments and modalities. So I'm here to guide you through that. So anyways, happy Thanksgiving, guys. I know it's coming up, and I will be seeing you in another video very soon on ear seeds and the benefits. So please subscribe. That's going to help get our health and wellness channel out there to really serve the population all over the world for new alternatives, natural alternatives for healing and wellness. So I'm sending my love to you. Mwah. Dr. Michelle, I'm here for you. Reach out if you need me. Send me a comment or a question. Okay, much love. Bye-bye.